Welcome to my office. My name is Joe Cioffi. I'm an independent agent that specializes in Medicare. I'm licensed in 16 states. Today we're going to talk about ATRIO Medicare Advantage plans. First, a little bit more about me. I started in insurance in 1991, got out of it in 98 and came back to it in 2013. And since then, I've specialized mostly in Medicare and senior insurance products revolving around life and health. I'm a veteran of the U.S. Air Force. I'm a disabled veteran. I actually have Medicare as well as the VA, so if anybody else here has questions about that, I'm well versed in that. I have 3 children that grew up here in Oregon as well. One still lives here with her family, and she got her PhD from the University of Oregon, as well as her undergrad and master's degree. And then my son is a staff sergeant in the U.S. Air Force Station over in England. And my youngest daughter just finished her master's at the University of Denver and now lives in Minnesota. So this is ATRIO's first year in Lane County, but I've actually been certified to offer ATRIO for 2 years now. The agenda today is why ATRIO health plans, understanding your Medicare choices. I got to go through that. That's kind of required by Medicare. Eligibility and enrollment, advantages of Medicare Advantage prescription drug coverage, 2024 Medicare Advantage plan information, and agent assistance and next steps. Like I said, ATRIO, for 20 years, ATRIO has delivered high quality health insurance at reasonable prices, leveraged the talents of their people and foster deeper community connections. You know, customer service excellence is huge with them. And a nice thing with them, when you call customer service with ATRIO, you're probably going to talk to somebody right here in Oregon. Physician-led care coordination programs. In other words, when you go into the hospital for something major, they're watching, they're coordinating your care. They're making sure you're going to have as few problems as you can. They know, like I know, the worst thing you can do is start stressing out over stuff when you're sick. Stress it does not help you when you're sick. So educational resources they make available, access to quality care, and their goal is better patient outcomes. Understanding the coverage building blocks of Medicare. So Part A helps pay for hospital stays and inpatient care. Also hospice. You don't have to pay for Part A. It's what you've had deducted out of your payroll all these years. Part B is everything else that's done as an outpatient. Doctor visits, physical therapy, durable medical equipment like wheelchairs or oxygen at home, injections you might be getting at the doctor's office. And so that's what makes up Original Medicare, which is provided by the federal government. Then after you enroll in Original Medicare, there's 2 options. The first one is Medicare Supplement. Those are all offered by private companies. They help pay some of your out-of-pocket costs. Most plans offer an A, an N, and a G. And every plan's A, N, and G are pretty much the same. The only thing that differs, there's some extra benefits with some plans, but the big difference is usually just the premium. I do offer Medicare Supplement plans, but that's not what we're talking about today. And ATRIO does not offer one. And then Medicare Supplement plans do not include prescription drug coverage. So you would have to get a separate prescription drug plan. Those are all also offered by private companies. And that's basically known as Part D. If you don't get a prescription drug plan within 63 days of becoming eligible, there could be a penalty down the line when you do sign up for a prescription drug plan. So the second step option is Medicare Part C, also known as Medicare Advantage. Part C has to offer equal or better benefits than Medicare Part A and B. Most Medicare Part C, Medicare Advantage plans also include prescription drug coverage. And they may also offer additional benefits like dental, vision, hearing, those kind of things. When is someone eligible for Medicare? So legal residents must live in the United States for at least 5 years and enroll, including the 5 years just before applying for Medicare. They got to be at least 65 years or older, or younger than 65 with a qualifying disability. Usually, if you're on SSI disability, after 2 years, you become eligible for Medicare. However, if you have end-stage renal disease and you're on dialysis, or you have ALS, you immediately become eligible for Medicare in that situation. When can you enroll in a Medicare Advantage plan? So the initial enrollment period is 7 months long. It includes your 65th birthday, and the 3 months before and 3 months after. It begins and ends the first of the month earlier if your birthday is on the first of the month. So in other words, if your birthday is June 1st, your Medicare will start May 1st. If it's June 2nd, it will start June 1st. You may also choose to join a Medicare Advantage plan or prescription drug plan during the initial enrollment period. Although you're not required to enroll in a Part D, there may be a penalty charge, like I said already, to your Part D premium if you didn't enroll in prescription drug coverage when initially eligible for Medicare. Although you are not required to enroll in Part D, there may be a penalty charged to your Part D premium if you didn't enroll in prescription drug coverage when initially eligible for Medicare and didn't have other credible drug coverage to qualify for enrollment during a special enrollment period. Or you didn't enroll in prescription drug coverage within 63 days of losing your credible drug coverage. What's credible drug coverage, you're asking? So if you're still working and you're going to work past 65, you don't necessarily have to sign up for Medicare or Medicare Part D. But you have to have, you got to ask your HR person, is our group coverage considered credible? Okay. If that's the case, you don't have to sign up. If it's not considered credible, or in some cases when you have less than 20 employees covered by your group plan, then you might still have to sign up for Medicare. Going back to the annual enrollment period, during annual enrollment, you can add, drop, or switch your Medicare coverage. That goes from October 15th to December 7th. Then special enrollment periods, depending on your circumstances. Maybe you retire and lose your employer coverage, or your spouse does. You move out of the plan service area. You qualify for extra help or Medicaid, or you have been diagnosed with certain qualifying chronic diseases. Then there's the initial enrollment period, which we talked about already. That's when for most people, it's when they turn 65 and they become eligible for Medicare. Again, 3 months before the month you turn 65, the month you turn 65, and 3 months after is what makes up that initial enrollment period. And then right now we're in what's called the open enrollment period. That's if you're already on a Medicare Advantage plan, you can make a one-time switch to a different Medicare Advantage plan, or you can go back to original Medicare and pick up a standalone prescription drug plan if that's what you wanted to do. Okay, but it's only a one-time change, whereas in the annual enrollment period, you can change as much as you want. It's the last plan you enroll in, it sticks for January 1st. Prescription drug coverage, there's 4 drug payment stages, okay? And this applies again to every prescription drug plan, Medicare Advantage, or Part D plan, standalone Part D plan. There's an annual deductible stage. During that stage, you pay 100% until you reach the deductible limit. So some plans might have, the maximum is $505, I believe, this year. Some plans even have a 0 deductible, depending. Okay, but once you hit that stage, once you've paid that amount then you go to the initial coverage stage. And that's the copays and coinsurance set by the drug plan for whatever tier your drug happens to be. It might be a 0 copay, it might be 25% coinsurance. The plan pays the balance after you've paid your copay or coinsurance, and you stay in that stage until your total drug cost reaches $5,030. The donut hole or coverage gap, once you've hit this total drug cost at $5,030, then you go in the donut hole and it's 25%, your share is 25% of the cost of your drug costs. until you hit a total out-of-pocket cost of $8,000. After your total out-of-pocket cost hits $8,000, then you're in the catastrophic stage. In this year, you have no other copays or coinsurance once you've hit that stage. So the difference between total drug costs and out-of-pocket drug costs. Total drug costs is what you pay for prescription drugs each year plus what the plan pays. It does not include your premium. Out-of-pocket drug costs is the total amount you pay for prescription drugs, including your deductible and any discounts paid by drug manufacturers while you are in the donut hole. Does not include what the plan pays or your premium. So ATRIO offers you pharmacy network flexibility, and they have 6 drug tiers. Preferred generic, generic tier, preferred brand, non-preferred brand, specialty drugs, and select care drugs. Normally as tier 6 you'd think it's going to be higher, but in this case it's a 0 copay tier for certain important medications like insulin, select insulins, Part D vaccines like your what is it called? Shingrix vaccine, or the flu vaccine, or the pneumonia vaccine, and then as well as high blood pressure medication, medication for your diabetes like metformin or glipizide, or your statin drugs to treat high cholesterol. Also for certain insulins, the max you're going to pay is $35. That even includes going into the coverage gap or the donut hole. Types of restrictions you might find on formulary drugs. First, there's prior authorization. Prior authorization means that you have to get prior authorization from the drug plan before they'll start filling that prescription for you. Now, you can also, your doctor just has to submit reasons why you need to be on that drug. Quantity limits usually applies to painkillers and those kind of things, but they limit the supply that you can get. But your doctor can also ask for an exception in this case. Step therapy is when the doctor prescribes you a more expensive drug. The drug plan comes back and says, well, we've had patients that have done well on this less expensive drug. We would like David to try that drug first. And you can, the doctor can again say, no, we've already tried that drug, it doesn't work. She needs this drug, and get an exception. And then Part B versus Part D review. Some drugs are covered as part of your Medicare Part B coverage, and others are covered under your Part D coverage. So now we're going to get into specific information about Medicare Advantage plans. With ATRIO, 20 years in Oregon. ATRIO was started by 3 doctors. That's why it's called ATRIO. I believe out of Roseburg. PPO plan offerings allow you to seek medical providers anywhere in the United States, but you do have out-of-network costs if they're out-of-network here. Members have the freedom to choose their preferred pharmacy, 0 copay on selected insulin through their Tier 6 peace of mind and lower RX costs, and rich supplemental benefits such as their Flex Card, which covers the dental, the gym memberships, and the over-the-counter benefits, plus there's meals after a qualified hospital or nursing home stay, routine vision exams, telehealth, transportation, wearable devices like the Help I Fallen Can't Get Up, worldwide emergency room coverage, and urgent care. As a new member, you're going to receive a welcome call from ATRIO. You'll get a quick reference guide. You'll get a welcome packet, and then you'll have local support. There's actually, they try to put a customer service office physically in every community they serve. There's not one in Lane County yet. They're working on it, but it's not here yet. You're going to get your member ID card from ATRIO. That's what you use at the doctor's office and the pharmacy. And then there's the Flex Card. You'll also get that card in the mail. That's what you use at the dentist, for your fitness benefits, or over the counter. Your over the counter benefits. So things like, that's like your vitamins, your aspirin, Band-Aids, health related stuff. Some stores actually put OTC next to the price tag of a drug, and that's when you know you can use it. And generally, you can use it at Walgreens, Rite Aid, Fred Meyer, Walmart. I think I'm missing someplace, but you'll get that information in your information packet. Additional resources that are available for you: there's a Medicare Shopper's Guide, the Medicare Helpline, Medicare.gov, Social Security Administration, and Elder Care Locator, and state resources such as SHIBA. Your 2024 enrollment kit, if you choose to enroll, we'll provide that to you today. And we're going to go over, there's 4 plans listed here. I'm going to go over 2 of them. That's the ATRIO Choice and the ATRIO Select. First, the Choice, 0 monthly premium, 0 deductible, maximum out of pocket annually is $3,600 in or out of network. A lot of plans you'll look at will say $3,600 in network. Well, actually, there's a lot higher than that even. And then like $7,000 to $10,000 out of network. In this case, it's $3,600 max in or out of network on your medical costs. That's anything that you see here. These are things that would typically be covered by Medicare. So primary care visits are 0 in network, $50 out of network. Specialist visits are $25 in or out of network copays. Telehealth is 0 out of network, it's not covered. Hospital codes, inpatient hospital, $375 a day for the first 4 days. That includes the surgeon, the anesthesiologist, gourmet meals, fancy slippers, any tests that are done in the hospital as an inpatient. The most you're going to pay per day is $375. That's in or out of network. Skilled nursing, it's a $10 copay up to the first 20 days, then it goes up to $200 a day. Out of network skilled nursing is 50% per stay. Outpatient hospital, 0 to $375. The out of network for the next 5 items you can see are 50%. Ambulatory surgery center, that's like Slocum or Oregon Urology or Northwest Surgical Services. If you're not having that day surgery at the hospital, you have it at one of those places, the copay drops down to $250. That's, again, is all inclusive. That's the surgeon, the anesthesiologist, everything that's done during that outpatient surgery. Home health care. Most of it, that's if you need home health care after a hospital stay for rehabilitation, a little bit of help with activities of daily living. That's a 0 copay. Diabetes supplies. That's like your test strips, the finger sticks, the glucose monitors. Those are all 0 copay. Durable medical equipment has a 20% coinsurance. Labs are 0. Out of network, it's 15. Diagnostic imaging or diagnostic tests, 0 to up to $300 maximum. Out of network, it's 50%. X-rays are 0. Out of network is 50%. Now, Oregon Imaging, Peace Health, those are all in network. So, McKenzie Willamette is also in network. Emergency services, ambulance is $250, emergency room is $90. That's worldwide, anywhere. If you're admitted because of an emergency, then that's waived if you're admitted within 24 hours. Urgent care is $60. Going over to the select plan, it has a premium of $40.60. However, if you're on extra help or the low income subsidy or Medicaid, that $40.60 drops to 0. In-network maximum out-of-pocket's $3,400. Out-of-network is $4,950. Primary care visits are 0. In-network $50. Out-of-network specialists are $30. Telehealth 0 for in-network. Hospital copays $325 a day for up to 4 days. After that, you don't pay anything. $20 per day for skilled nursing facility after a hospital stay, $200 per day, days 21 through 100, out of network 50%. Outpatient hospital is up to 0 to $350. Again, ambulatory surgery center is $250. Home health care 0, diabetes supplies 0, durable medical equipment 20%. Labs are 0, out of network 15. Diagnostic imaging like MRI, CT, PET scans, maximum is $250. X-rays are 0, out of network 15. And then the ambulance, emergency room, and urgent care are the same. Now, things that Medicare doesn't cover: annual physical exam, zero copay for both plans. Neither plan covers chiropractic or acupuncture. Fitness benefit. Now, again, you're using your Flex card. You get up to $300 a year for gym membership fees and classes. With the Select plan, it's $600. The personal emergency response system, the necklace, or there's even a wristwatch option with a heart monitor and step counter. That's a zero copay. $4,000 allowance on the Flex card for dental. You just go to any dentist. There's no network. It's just like you're paying with your Visa card, and it is a Visa card. Routine vision exam, zero for both plans. $150 allowance for glasses and frames for both plans. $100 for contacts. Routine hearing exam is zero. You can get hearing aids. They give you a $1,500 allowance through Amplifone. Now that's different. Most plans have a copay. So you're going to have a copay for your hearing aids. You're definitely going to have something out of pocket. But if you can get 2 hearing aids for $1,500, you don't pay anything. So that's different with ATRIO. Meals, up to 2 meals per day for 14 days after a qualifying health event. And then transportation, you get 12 one-way trips to a plan-approved health-related locations. That's dental. I've been told that we even drive you up to the VA in Portland. Okay. That's included with both of these plans. Most plans, it's only available if you're on a dual plan, like you're on Medicaid, or if you're like on a chronic special needs plan. Over-the-counter benefits, $50 through your Flex card on the Choice plan, $170 on allowance on the Select plan. Prescription drug copays. So for the Choice plan, the first two tiers are zero copay for a 30 or a 90-day supply. If your doctor will write a 100-day supply, that will also apply, zero copay. Tier 3 drugs are $47 copay, $94 for a 90-day supply. Tier 4 drugs, $100, $200 for 90. Tier 5 drugs, 33%. You cannot get a 90-day supply of Tier 5 drugs. And then here's talking about the coverage gap. You know, it's basically a 75% discount. You're paying 25% of the retail costs, and once you hit the catastrophic stage, you don't pay anything. Over for the Select plan, you can see that the copays are the same. Star ratings. ATRIO's plan is rated 3 stars. There's 2 main types of star ratings. There's the overall star rating, and that's what I just referred to. And then there's summary star ratings that focus on Part C and prescription drug services. If you'd like to see star ratings, you'll get one with the enrollment kit. Some areas of Medicare reviews for these ratings is how members rate the plan, how well doctors detect illnesses, how many members stick with the plan. By the way, ATRIO last year had a 98% retention rate. I believe that's what it was, 98 or 97. How well the plan helps members use recommended and safe prescription drugs is also something to consider, but there's actually 50 different things that they look at. I'm here to help you. We can look up doctors today, hospitals, both Peace Health, Riverbend, and McKenzie-Willamette are in network. I can check to make sure your prescriptions are in formulary. Access additional services that are benefits available to ATRIO health plans. Understand how Medicare Advantage plan from ATRIO health plans can work with the VA or TRICARE and find out if you're eligible for things like extra help or any other benefits. And like I said, if you're ready to enroll, we've got enrollment kits we can help you with. If you're not quite ready, on every table in front of you, there's a have questions that you can fill out, and we'll give you a call. If you'd like to set an appointment for another time, we can fill out a scope of appointment form and do that. So, thanks for coming.